Hi, I wanted to do a demonstration with the urethral catheter electrode and 60 cycle artifact after talking to a lot of clinicians who are using this, and they had questions about 60 cycle artifact with this electrode. So I have a mock-up. We have a fresh pig skin that is a mock-up for the urethra, which is a pigskin sandwich, and the contacts of the urethral catheter electrode are inside of that sandwich. I have the isogram there, and then we've got a large surface area pigskin representing, say, just the skin of your patient's legs, and of course the remainder of the Foley is sitting on top of that. The urimeter bag tube is sitting on top of that, and then the lead wires, etc., and plugged into the amps, and we can see the recording here. Right now, all of that is sitting on top of a towel, so it's technically not touching this patient skin, the pig skin. I have a wonderful noise source known as my skin, and I happen to be holding a power cord plugged into the wall, so I've got a super noise source. And yes, when I touch the mock urethra, you can see the 60 cycle artifact being picked up. When I touch the patient's skin, I'm able to see a bit of 60 cycle artifact here. It's not very large. And now, if I remove this towel, everything is just going to be sitting directly onto the patient's skin. And when forgive my old amplifiers, when they come out of saturation, we can already see a slight increase in electrical artifact. And you can see this 60 cycle artifact now being picked up when I touch the same locations of the patient's skin. What is the take-home message? There's a lot of surface area here, and even though plastic is non-conductive, it can hold charge, which means that it's capacitive, it can hold charge, and that 60 cycle artifact can travel on it, especially when it's up against the patient's skin, which is a very conductive corridor. So it's a good idea, if you take the catheter in place to create that gentle traction to keep the bladder up against the meatus, the balloon up against the meatus of the bladder. It's a good idea to put some gauze or something in between when you tape it, so that all of this plastic stays off of your patient, of direct contact with your patient's skin. Hope this helps.